Healthcare workers and anyone involved in the management of burial or suspected confirmed COVID-19 patients will be required to adhere to the guidelines. From the guidelines, 3 main processes will be involved: identification of the deceased, certification of death, and disposal of the human remains. Before the process, the cause of death has to be established. If it is a natural death without COVID-19 concern, then the body will be taken to a funeral home or crematorium. However, if preliminary investigation meets the definition for coronavirus at the time of death, the Ministry of Health shall be notified and assume jurisdiction to determine the need for laboratory confirmation and autopsy. Before commencement of the handling of the remains, the family will be fully informed about the dignified burial process and their religious and personal rights to show respect for the deceased. The team which will handle the funeral will include a family representative, a public health officer, local administrator, chief or assistant chief, security, and any other co-opted health professional. The steps to be followed during the interment will be as follows: arrival of the body disposal team, to which the staff should not be wearing personal protective equipment upon arrival, greet the family and offer condolences before unloading the necessary material from the vehicles, request respectfully for a family representative. The communicator should liaise with the family representative for the final rites. Before handling the remains, health officials will be required to be in protective gear and will spray the body before placing it in the appropriate body bag. If a coffin is necessary, it will be placed outside the house, and then the body will be placed by health officials in full protective equipment. A family representative in gloves will then be allowed to close the coffin, after which it will be disinfected. The body will then be interred. After the burial, health officials will disinfect rooms, clothes, or other items that the deceased may have used or interacted with before they leave the home. Deaths occurring outside a health facility will be reported through the established guidelines for notification of deaths from infectious disease causes. So far, Kenya has recorded 8 deaths, with a recent disposal of the body of a 59-year-old man identified as James Oyugi happening in Siaya. Winnie Lubembe for Ebru TV.